Dr. Talbot, welcome back to our program. I'm glad to see you at this time where Alberta's right at the top of the news for all the wrong reasons again today.
Yeah, we're number one again, and that's not a contest you really want to be leading. We have, as was mentioned, the highest per capita rate of new cases. We have gone past the maximum occupancy of ICU beds, and we still have the lowest full immunization rate in the country. It's a deadly combination.
Well, it is, and it's so worrisome. As we focus on the ICUs for just a moment, as you said, overcapacity, the highest number of people going into the ICUs of Alberta hospitals of the entire pandemic. What concerns you most about the type of patients that you're seeing there in the ICUs?
Two things. One is that it's the unvaccinated. So we have a situation where the government is holding hostage 70% of the population who might need elective surgery or even more urgent surgery to the 30% who have not been immunized. And the second thing is that even with that occupancy, we're starting to see the mortality rates increase, including in rare but concerning instances, people who've had 2 doses of the vaccine, but unfortunately have had close and lengthy contact with someone who's infected. So both those things cause grave concern. And sorry, just the other thing is that nothing has been done to change the situation.
Well, in terms of the unvaccinated, I'm sorry, I didn't mean to cut you off. I was just going to jump in and say there was the offer put forward, the direct $100 to encourage Albertans to get that dose, that vaccination dose. Will that have any direct impact?
Well, it's been almost 7 days since that happened, and we've seen nothing. Usually incentives work pretty quickly. The vaccine passports, which we've been recommending and have already proved successful in BC, Quebec, and Ontario, showed almost an instantaneous doubling in the number of people seeking immunization. So the incentive program at this point is an absolute failure.
We've been talking to a number of medical colleagues in Alberta, and an emergency room doctor was telling us earlier that he has tremendous concerns about capacity. You mentioned already overcapacity in the ICUs. Listen, if you would, to him again with me, and then I'll get your perspective on what he raises.
How are we going to temper this current wave? And, the big question is, if we've reached our peak already, that's great. But what if we haven't? What if the peak is still coming in another 2 weeks? And can this system, hold tide for that time period? And I'm worried it can't or it won't.
So again, the concerns of a general surgeon there, Dr. Karmali. What if in a couple of weeks? What do you think? Can the system withstand?
I think we're looking at the potential of an acute care system failure, defined by having to invoke a triage protocol that decides who lives and who dies, and flying ICU patients to other jurisdictions, which is going to be difficult because they're not going to Saskatchewan, and BC is already stressed as well. I think the thing that the people who are listening to this need to understand is that a triage protocol sounds like just another medical protocol. I've never seen a triage protocol implemented. I doubt that the vast majority of Canadian physicians who haven't served in the military or been through a war have ever seen a triage protocol. A triage protocol is the signal that you're no longer in crisis, you're in full meltdown.
It is a list of criteria which determine who receives critical care, who does not, who lives and who dies. So imagine this scenario for me then, Dr. Talbot. Someone's in the ICU needing critical care because he or she's had a heart attack. On the other hand, is somebody who's in the ICU needing critical care because he or she did not get a vaccination and develop COVID. Who gets the care?
Well, the protocol is meant to do the thinking on that before it happens, and it takes in a mix of things, including the age of the person and underlying conditions. The thing I'd like to emphasize about what you're asking me to do is that I would be scarred for life having to make that decision. And it's something that the Alberta government is not prepared to spare our healthcare providers from making that decision. And it's not because they can't do something about it, it's because they won't. They could bring in passports, they could bring back the measures that slowed and stopped transmission before, and they're choosing not to.
Is this the point that you think we're going to reach, maybe not just in Alberta, but elsewhere, if there are people who have opted not to get the vaccination and who are in need of these very scarce resources? Will we be having discussions about whether they should get care?
Almost no other jurisdiction was as irresponsible as Alberta in throwing open the province as they did in July, where they eliminated all precautions. And they were told at that time that this would be the result. You would slam the hospitals. If you open up more slowly, you can bend the curve in such a way that the hospitals aren't as stressed as they are. So Saskatchewan went the same misguided route. BC went partially there. I think the rest of the country has been acting responsibly enough and has a high enough immunization rate that they may be spared this. But the key thing that I'd like to get across to people in Alberta right now is that if you're unvaccinated and you end up getting infected, as the numbers suggest that you will, and you need a hospital, you may not have a hospital that has space for you. So get immunized now. Even a single dose will protect you will provide some protection against that worst case scenario.
Dr. Talbot, I appreciate this very much from you. It's a bit demoralizing not just to hear this, but even to have to ask you these questions as we've had these conversations months ago, and here they are again, but even more critical this time. Thank you so much. Dr. James Talbot, the former Alberta Chief Medical Officer of Health and co-chair of Alberta's Strategic COVID-19 Pandemic Committee.